Hi, my name is Cassandra Snyder Wyatt. I'm an 8th semester nursing student here at Lincoln University, and today I'll be showing you how to do a central line dressing change on a patient. So I'm going to go ahead and walk into my patient's room, introduce myself, make sure I provide privacy, wash my hands. I'm going to ask them their name and date of birth, verify that they have an order for central line and for it to be dressed and changed. And then I'm going to go ahead and let them know that I'm going to be doing their dressing change. So at this point, I've went ahead and I've washed my hands. I'm going to put on some clean gloves. Maybe. Okay. Then I'm going to go ahead and take this dressing off of this mannequin here, my patient. Whenever I take this dressing off, I want to make sure that I'm holding their skin so that I'm not pulling their skin with this dressing. Just want to be mindful that I am working with a human here and that this can pull hair and it can be painful, so I'm going to do my best to kind of pull it off. As I'm pulling this dressing off, I'm also assessing the insertion site for any signs of infection, redness, any kind of drainage, if it was warm or edematous. I want to look at my dressing for any type of drainage. If there was any kind of purulent drainage, I would go ahead and culture that. Go ahead and go grab a swab and a culture kit and culture that. There's not, so I'm not going to worry about that, but I would be assessing the dressing for that as well. I can go ahead and throw that away. I'm going to take my gloves off. I'll wash my hands again. At this point, I'm going to go ahead and open up my sterile dressing change kit here. Inside of this, there will be 2 masks. I will put one on and my patient will put one on. These are kind of a pain to open sometimes here. Okay, so I'm going to put a mask on. And then I'll give this to my patient. They can put it on themselves if they're able to, or if they're not able to, I would put it on them. We're going to do the best I can here with my mannequin. Okay, so my mannequin has his mask on. So at this point, I'm going to go ahead and grab a set of sterile gloves. There's 2 in this kit, so I just need one. So I kind of broke this package, so I'm going to use that other one that I kind of put over here. I'm going to be mindful on how I open my gloves here because I don't want to contaminate them. Okay. So these gloves kind of come in a pain in the butt way to don them. So I'm going to don these gloves, being mindful that these are sterile and I don't want to touch the inside of the cuff or anything outside of the cuff here. So it rolled here, so I would go ahead and grab myself another set of sterile gloves. Same concept there, that kind of rolled, so I'd want to make sure that I grabbed another set of sterile gloves and donned a new pair of sterile gloves. I would be mindful as I throw this away. I don't need this part. I'm looking for my chlorhexidine swabs as of right now. I'm going to go ahead and open these chlorhexidine swabs. I'm going to take a swab and I'm going to vigorously rub vertical and horizontal around this central line. I'm rubbing for 30 seconds a piece on each swab, and I'm wanting to make sure that I get a 2 to 4 inch border around this patient's central line. And then if you touch their skin, kind of like I did there, you want to make sure that you broke sterile field and you want to do it again. So I rub for 30 seconds. I'm going to kind of do the same thing with this swab. rubbing for 30 seconds. 30 seconds has passed. One more swab. And with this one, I'm gonna, of course, go ahead and clean around the area. But I'm also gonna kind of rub down the line here. Just kind of making sure that everything gets clean. And this again is for 30 seconds. At this point, I'm done cleaning, and I can go ahead and let this dry for 30 seconds. You don't want to fan it, you don't want to blow on it, you don't want to do anything. Just let it air dry for 30 seconds while you get your occlusive dressing ready. Okay, so I'm going to say it's been 30 seconds here. I'm going to do my best that I can here with this mannequin to apply this Tegaderm. Of course, with an actual person, they would have their head turned sideways, so this would probably be a little bit easier to cover than what it is now with this mannequin that is got skin that stuff doesn't stick to and all that good stuff. So I'm just doing the best that I can here. And then you'll want to peel this little outside piece of the Tegaderm off. Making sure that it's an occlusive dressing around the central line. There is a little date stamp sticker that you'll take off of this outside of the Tegaderm. You're going to place it on the patient. You'll time, date, and initial this sticker to signify that you changed the dressing and let the next nurse know when the next dressing is. At this time, I can remove my mask, doff my gloves, remove my patient's mask, wash my hands, and then go ahead and go document that I did the dressing change, how the patient tolerated it, and then how the site looked. So if there was any kind of purulent drainage, if there was, what color was it, if there was copious or scant amount, if it had an odor, the fact that I sampled it and sent the sample down to the lab and called the physician for an order for that. And if it was clean, dry, and intact, the dressing, then you can document that and just that you changed it.